161. Which finding suggests reinfarction in a post-MI patient? A. Stable chest pain. B. New ST elevation. C. Reduced troponin. D. Normal EKG. Answer. B. New ST elevation. Rationale. New ST elevation in a post-MI patient suggests reinfarction, indicating fresh ischemia. Stable pain, reduced troponin, or normal EKG don't signal new injury. B is correct. 162. Which factor increases MI risk by promoting platelet aggregation? A. Smoking. B. Low HDL cholesterol. C. Regular exercise. D. Omega-3 intake. Answer. A. Smoking. Rationale. Smoking promotes platelet aggregation, increasing MI risk via thrombus formation. Low HDL affects lipids. Exercise and omega-3s reduce risk, not enhance it. A is correct. 163. A patient with MI reports chest tightness lasting 20 minutes. This is A. Stable angina. B. Acute MI symptom. C. Musculoskeletal pain. D. Anxiety attack. Answer. B. Acute MI symptom. Rationale. Chest tightness lasting 20 minutes is an acute MI symptom as it exceeds angina's typical duration, less than 10 minutes, and suggests ischemia. Musculoskeletal and anxiety pain differ in nature. B is correct. 164. Which EKG change in lead AVR suggests severe multivessel disease in MI? A. ST depression. B. ST elevation. C. Q waves. D. T wave inversion. Answer. B. ST elevation. Rationale. ST elevation in AVR with widespread ST depression suggests severe multivessel or left main disease in MI, a critical finding. Other changes are less specific for the severity. B is correct. 165. What does a peak CKMB level 24 hours post-MI indicate? A. Ongoing necrosis. B. Peak myocardial injury. C. Stable angina. D. Non-cardiac injury. Answer. B. Peak myocardial injury. Rationale. CKMB peaks around 24 hours post-MI, indicating the height of myocardial injury. Ongoing necrosis would extend beyond, angina doesn't elevate it, and non-cardiac injury is less specific. B is correct. 166. Which medication should be held if a post-MI patient develops a rash? A. Aspirin. B. Nitroglycerin. C. Clopidogrel. D. Metoprolol. Answer. A. Aspirin. Rationale. Aspirin should be held if a rash develops post-MI, as it may signal an allergic reaction, e.g., aspirin sensitivity. Others are less commonly linked to rashes in this context. A is correct. 167. Which MI complication is indicated by jugular vein distension? A. Pericarditis. B. Right heart failure. C. Ventricular rupture. D. Arrhythmias. Answer. B. Right heart failure. Rationale. Jugular vein distension post-MI suggests right heart failure, often from right ventricular infarction. Pericarditis, rupture, and arrhythmias don't typically cause JVD. B is correct. 168. What is a key nursing intervention to prevent MI in at-risk patients? A. Encourage smoking. B. Teach stress management. C. Limit water intake. D. Reduce fiber intake. Answer. B. Teach stress management. Rationale. Teaching stress management prevents MI by reducing sympathetic activation and BP in at-risk patients. Smoking, limited water, and low fiber increase risk. B is correct. 169. What does ST elevation in V4R indicate in MI? A. Left ventricular MI. B. Right ventricular MI. C. Posterior MI. D. Lateral MI. Answer. B. Right ventricular MI. Rationale. ST elevation in V4R right-sided lead indicates a right ventricular MI, often from right coronary occlusion. Other MIs affect different leads. B is correct. 170. What is the primary source of myocardial damage in MI? A. Inflammation. B. Oxygen deprivation. C. Mechanical stress. D. Electrolyte imbalance. Answer. B. Oxygen deprivation. Rationale. Oxygen deprivation from coronary occlusion is the primary source of myocardial damage in MI, causing ischemia and necrosis. Inflammation and stress are secondary, and electrolytes affect rhythm. B is correct. 171. Which medication is used to manage arrhythmias post-MI? A. Nitroglycerin. B. Amiodarone. C. Heparin. D. Alteplase. Answer. B. Amiodarone. Rationale. Amiodarone manages arrhythmias post-MI, stabilizing electrical activity. Nitroglycerin relieves pain, heparin prevents clots, and alteplase dissolves them, not arrhythmia-focused. B is correct. 172. A patient with MI reports indigestion. This is likely A. Gastrointestinal upset. B. Referred pain. C. Medication side effect. D. Panic attack. Answer. B. Referred pain. Rationale. Indigestion in MI is referred pain due to shared nerve pathways, especially in atypical presentations. GI upset, meds, and panic are less likely acutely. B is correct. 173. Which test is used to monitor MI treatment effectiveness? A. Troponin levels. B. EKG. C. Echocardiogram. D. All of the above. Answer. D. All of the above. Rationale. Troponin monitors necrosis. EKG tracks reperfusion, e.g., ST resolution, and echocardiogram assesses function, all gauging MI treatment effectiveness. D is correct. 174. What is the primary purpose of nitroglycerin in acute MI? A. Prevent clot growth. B. Relieve ischemic pain. C. Lower cholesterol. D. Increase heart rate. Answer. B. Relieve ischemic pain. Rationale. Nitroglycerin relieves ischemic pain in acute MI by dilating coronary arteries and reducing preload. It doesn't affect clots, cholesterol, or heart rate directly. B is correct. 175. Which MI complication is most likely to cause sudden cardiac arrest? A. Heart failure. B. Ventricular fibrillation. C. Pericarditis. D. Aneurysm. Answer. B. Ventricular fibrillation. Rationale. Ventricular fibrillation is the most likely MI complication to cause sudden cardiac arrest due to chaotic electrical activity. Others are serious but less immediately lethal. B is correct. 176. Which dietary habit increases MI risk by raising BP? A. High potassium intake. B. High sodium intake. C. High fiber intake. D. Low fat intake. Answer. B. High sodium intake. Rationale. High sodium intake increases MI risk by raising BP, stressing vessels. Potassium and fiber are protective and low fat doesn't directly raise BP. B is correct. 177. What physical sign indicates poor perfusion in acute MI? A. Warm, dry skin. B. Cool, clammy skin. C. Flushed face. D. Normal pulse. Answer. B. Cool, clammy skin. Rationale. Cool, clammy skin indicates poor perfusion in acute MI due to sympathetic vasoconstriction from low cardiac output. Warm skin, flushing, and normal pulse suggest stability. B is correct. 178. What is the role of aspirin in acute MI? A. Dissolve clots. B. Reduce platelet aggregation. C. Increase oxygen supply. D. Lower heart rate. Answer. B. Reduce platelet aggregation. Rationale. Aspirin reduces platelet aggregation in acute MI, preventing thrombus growth. It doesn't dissolve clots, increase oxygen, or lower heart rate. B is correct. 179. Which risk factor for MI is linked to sedentary behavior? A. Obesity.
B. Smoking.
C. Hypertension. D. Family history. Answer. A. Obesity. Rationale. Obesity, often from sedentary behavior, increases MI risk by promoting atherosclerosis and inflammation. Smoking, hypertension, and family history have different links. A is correct. 180. What EKG change suggests a non-STEMI and leads V1, V4? A. ST elevation. B. ST depression. C. Q waves. D. Tall T waves. Answer. B. ST depression. Rationale. ST depression in V1, V4 suggests a non-STEMI, indicating subendocardial ischemia. ST elevation is STEMI, Q waves are prior MI, and tall T waves are unrelated. B is correct. 181. Which intervention is most critical within the first hour of MI? A. Statins. B. Oxygen administration. C. Beta blockers. D. Clopidogrel. Answer. B. Oxygen administration. Rationale. Oxygen administration is most critical within the first hour of MI to improve myocardial oxygenation and reduce ischemia. Statins, beta blockers, and clopidogrel are important, but secondary acutely. B is correct. 182. Which lifestyle factor increases MI risk by raising triglycerides? A. High-fiber diet. B. Excessive alcohol. C. Regular exercise. D. Smoking cessation. Answer. B. Excessive alcohol. Rationale. Excessive alcohol increases MI risk by raising triglycerides, contributing to atherosclerosis. High-fiber diets, exercise, and quitting smoking reduce risk. B is correct. 183. A patient with MI reports a heavy chest sensation. This is classified as A. Stable angina. B. Typical MI symptom. C. Musculoskeletal pain. D. Psychogenic pain. Answer. B. Typical MI symptom. Rationale. A heavy chest sensation is a typical MI symptom due to myocardial ischemia, distinct from angina's shorter duration. Musculoskeletal and psychogenic pain have different origins. B is correct. 184. Which EKG finding in leads 2, 3, AVF suggests reciprocal changes? A. ST elevation. B. ST depression. C. Q waves. D. T wave inversion. Answer. B. ST depression. Rationale. ST depression in 2, 3, AVF as reciprocal changes suggests an acute MI elsewhere, e.g., posterior, reflecting opposite electrical vectors. Elevation is primary, Q waves are late, and T inversion is subacute. B is correct. 185. What does an elevated myoglobin level indicate in early MI? A. Myocardial damage. B. Kidney dysfunction. C. Stable angina. D. Non-cardiac injury. Answer. A. Myocardial damage. Rationale. Elevated myoglobin in early MI rises within 1 to 4 hours, indicates myocardial damage, though it's less specific than troponin. It's not kidney-specific, angina doesn't elevate it, and non-cardiac injury is less likely acutely. A is correct. 186. Which medication is avoided in MI if the patient has asthma? A. Aspirin. B. Beta blockers. C. Nitroglycerin. D. Heparin. Answer. B. Beta blockers. Rationale. Beta blockers are avoided in MI with asthma due to risk of bronchospasm from non-selective effects. Aspirin, nitroglycerin, and heparin are safe in this context. B is correct. 187. Which MI complication is most likely to cause refractory hypotension? A. Heart failure. B. Cardiogenic shock. C. Pericarditis. D. Ventricular aneurysm. Answer. B. Cardiogenic shock. Rationale. Cardiogenic shock causes refractory hypotension post-MI due to severe pump failure. Heart failure may lower BP but responds better. Pericarditis and aneurysms don't typically cause this. B is correct. 188. What is a key patient education point to prevent MI recurrence? A. Avoid all exercise. B. Monitor BP regularly. C. Increase sodium intake. D. Skip medications. Answer. B. Monitor BP regularly. Rationale. Monitoring BP regularly helps prevent MI recurrence by managing hypertension, a major risk factor. Avoiding exercise, increasing sodium, or skipping meds increases risk. B is correct. 189. What does ST elevation in leads I and AVL suggest in MI? A. Inferior wall MI. B. Anterior wall MI. C. Lateral wall MI. D. Posterior wall MI. Answer: C. Lateral wall MI. Rationale: ST elevation in I and AVL suggests a lateral wall MI, typically from circumflex occlusion. Inferior, 2, 3, AVF, anterior, V1, V4, and posterior, V7, V9, MIs affect different leads. C is correct. 190. What is the primary energy deficit in MI-affected myocardial cells? A. Glucose depletion. B. Lack of ADP. C. Fatty acid excess. D. Protein breakdown. Answer: B. Lack of ADP. Rationale: lack of ADP is the primary energy deficit in MI due to oxygen deprivation halting aerobic metabolism. Glucose, fatty acids, and proteins are substrates, but ADP production fails. B is correct. 191. Which medication is used to reduce preload in acute MI? A. Beta blockers. B. Nitroglycerin. C. Clopidogrel. D. Statins. Answer: B. Nitroglycerin. Rationale: nitroglycerin reduces preload in acute MI by venodilation, easing myocardial workload. Beta blockers lower demand, clopidogrel prevents clots, and statins affect cholesterol. B is correct. 192. A patient with MI reports sweating profusely. This is due to A. Fever. B. Sympathetic response. C. Dehydration. D. Medication reaction. Answer: B. Sympathetic response. Rationale: profuse sweating in MI is due to a sympathetic response to pain and ischemia, activating sweat glands. Fever, dehydration, and meds are less likely acutely. B is correct. 193. Which diagnostic tool is used to assess MI-related valve dysfunction? A. Chest X-ray. B. Echocardiogram. C. CT angiography. D. Stress test. Answer: B. Echocardiogram. Rationale: echocardiogram assesses MI-related valve dysfunction, e.g., regurgitation, by visualizing valve motion. X-ray shows lung issues, CT scans vessels, and stress tests are unsafe acutely. B is correct. 194. What is the time frame for maximal benefit of PCI in STEMI? A. 60 minutes. B. 90 minutes. C. 3 hours. D. 12 hours. Answer: B. 90 minutes. Rationale: maximal benefit of PCI in STEMI occurs within 90 minutes, door-to-balloon time, to salvage myocardium. Shorter is ideal, but 90 is the target. Longer reduces efficacy. B is correct. 195. Which MI complication is indicated by a pericardial friction rub? A. Heart failure. B. Pericarditis. C. Ventricular rupture. D. Cardiogenic shock. Answer: B. Pericarditis. Rationale: a pericardial friction rub indicates pericarditis post-MI from inflamed pericardium. Heart failure, rupture, and shock have different signs, e.g., gallops, murmurs. B is correct. 196. Which dietary practice reduces MI risk by lowering inflammation? A. High sugar intake. B. Omega-3 fatty acids. C. High saturated fat. D. Low protein intake. Answer: B. Omega-3 fatty acids. Rationale: omega-3 fatty acids reduce MI risk by lowering inflammation and triglycerides. Sugar and saturated fat increase inflammation, and low protein is unrelated. B is correct. 197. What finding suggests acute MI on auscultation? A. S4 gallop. B. S3 gallop. C. Clear heart sounds. D. Systolic murmur. Answer: A. S4 gallop. Rationale: an S4 gallop suggests acute MI due to decreased ventricular compliance from ischemia. S3 indicates heart failure, clear sounds are normal, and murmurs suggest complications. A is correct. 198. What is the purpose of clopidogrel post-MI? A. Reduce preload. B. prevent platelet aggregation. C. Increase BP. D. Dissolve clots. Answer: B. Prevent platelet aggregation. Rationale: clopidogrel prevents platelet aggregation post-MI, reducing reinfarction risk. It doesn't affect preload, BP, or dissolve clots, thrombolytic role. B is correct. 199. Which risk factor increases MI risk by causing vessel stiffness? A. Hypertension. B. Obesity. C. Smoking. D. Sedentary lifestyle. Answer: A. Hypertension. Rationale: hypertension increases MI risk by causing vessel stiffness and atherosclerosis from chronic pressure. Obesity, smoking, and sedentary lifestyle have different mechanisms. A is correct. 200. What EKG change indicates successful reperfusion in MI? A. Persistent Q waves. B. ST segment resolution. C. New T wave inversion. D. Widened QRS. Answer: B. ST segment resolution. Rationale: ST segment resolution indicates successful reperfusion in MI, showing restored blood flow. Q waves are permanent, T wave inversion is subacute, and widened QRS is unrelated. B is correct.